So my name's Christine Goodall. I'm an oral surgeon, so I work as a senior lecturer at Glasgow University, and I'm also one of the directors of Medics Against Violence, which is a charity that works with healthcare professionals to do a number of different things, including talk to pupils in school about violence. It was founded really because I have a lot of experience personally of oral and maxillofacial surgery, and for people that don't know what that is, that's we deal with injuries and diseases of the head and neck, and we were seeing really loads and loads of patients coming in with facial trauma, so injuries to their face that could have affected their bones, their soft tissues, people with big lacerations, and most of it was a result of violence. Certainly in Glasgow, which is where I've mainly worked. And we just thought, it was a high time that we stopped just patching people up and sending them on their way, that we should really get involved in doing something to prevent them from coming in the first place. We have a lot of patients that come into our service who have facial injuries, obviously, and some of those you can fix and people will go away and other people may not know that they've had them. But the worst injury probably for somebody going forward into their future is to have a big scar on their face, and that's something that people find really difficult to cope with, because it does affect your life. I think it's useful for maybe young people to think about how they perceive somebody who has a scar on their face. What is their first thought? Because despite the fact that I know people have accidents and I know that sometimes scars are surgical and not from violence, my first thought when I see a man with a scar is, oh, better be careful of him, not quite sure, he might be a bit dangerous. And that's my first thought. And then I can put that to the back of my mind, but I think other people can't do that because they aren't so used to seeing people with scars. So it definitely affects how people perceive you as an individual. And I think for many of the people with these scars, which unfortunately we can't make disappear, plastic surgery is all very well, but it doesn't make scars disappear. They have to cope with that when they're trying to make relationships with people, when they're making friendships, when they're trying to get a job, a whole range of things like that. And it does definitely affect all of those things. Mm-hmm. So I think that's something that people don't think about. And young people, certainly in some of the gangs and things, they think it's big or clever to mark somebody on the face with a knife like that, but they never think about how that's going to kind of affect them going forward. So I think that's a big issue. The knife carrying issue in Scotland is still quite a big problem.